We are back right now with the latest on the coronavirus here in Connecticut. In fact, we just got these numbers into the newsroom. The positivity rate is below 1% today at 0.75%. That's a very good number there. There are currently 122 people in the hospital. That is down 7 from yesterday. COVID has been very, very tough on everybody over the past year and a half or so, including children who've had many issues with how it's affecting their mental health as well. So joining us live this afternoon is Dr. Laura Saunders, a psychologist at the Institute of Living. Dr. Saunders, always good to see you. Thanks for being here.
Thank you for having me.
What is exactly happening? What are you seeing in children after, more than a year of this, and many of them are starting to go back to school? They're still feeling some impact, are they not?
Absolutely. And so what we know is that in general, this is a difficult time of year for kids, right? Kids of all ages, elementary school, middle school, high school, college age is let out at this point. But, there's exams and pressure and all sorts of things amping up. On top of all the changes that have been happening, right? We've had like 14, 15 months of, closeness equals danger, and other people have germs, and all these messages that are coming into kids, virtual learning, hybrid learning, in school, sent to remote because of a COVID exposure. Think about all these changes. It's been really, really hard on young people. Their anxiety levels are up, their level of depression, and sadly, isolation, which has been a hallmark of this pandemic, only worsens anxiety and depression.
I mean, it's very, very tough on adults. I think we can both agree with that. So I can't imagine what it's doing to a child when they're still developing. What can parents watch out for? Are there things that maybe would stick out?
So I want parents to know that there are more relaxed guidelines now for a reason, right? There's a lot of people that are vaccinated. Our state's doing excellent. 12 to 15-year-olds can get vaccinated now. Let kids out, let kids interact, follow the guidelines, let them do some things that they used to typically do, and try to get them into routines. I think we'll see hopefully some improvement once summer's out, although some kids do worse with less structure, but let them get out, let them play, let them interact, do what they need to do to get back to things when they felt, more typical. This is a difficult time. We just need to be supportive to each other.
I'm curious, when we look at the summertime and at the school year coming, in the fall, and hopefully everyone will be back, do you anticipate a whole different set of issues now for some kids who've been so isolated? Maybe they've lost touch with friends and they have to rebuild these relationships all over again. That can be very hard when you're in school.
So I have a two-pronged response to that. Yes, I think that social anxiety levels are up. Social skills are skills that need to be practiced, right? So our young people lost a lot of practice in social skills. So yes, there's going to be some awkwardness. There's going to be some additional anxiety, which is why you have to provide them with ample opportunity. But on the other hand, I just want to hold on to hope that kids are resilient, and that the more we support them as adults, as parents, as teachers, as administrators, as caregivers, as aunts and uncles, the more we can tap into the resiliency and get them back into the flow, and help them out.
There's a lot to learn from kids, even for us adults sometimes, right?
Absolutely.
All right, Dr. Laura Saunders, always good to see you. Thank you so much for joining us this afternoon.
Thank you.